Hi, my name is Ian Matthews, and I will be doing my presentation on paralysis. I'm going to be covering the causes of paralysis, the types of paralysis there are, the symptoms, and treatments of paralysis. First of all, what is paralysis? So, paralysis is complete or partial loss of muscle function, and paralysis can often include loss of feeling or numbness in the affected area. So, a few types of paralysis could be facial paralysis, jaw paralysis, leg paralysis, paraplegia, which is paralysis of both legs, and partial paralysis, which can be in any limb or any part of your body at all. An example of this could be Bell's palsy on the left, which is paralysis of half of your face, which includes drooping and or numbness on that side. Who can be affected by paralysis? It can be anyone, but the most common types are if someone has a stroke, then it can cause that. The most is the number one cause. Two could be spinal cord injuries, which can affect the spinal cord and then cause it. Three, broken necks, and that can affect it obviously at the neck towards the brain, and you could lose all function of the lower body or just some. Neurological diseases, autoimmune diseases, and Bell's palsy are other examples of how someone could be affected. So the causes of paralysis, there are many causes, but it can stem from various sources, each presenting its unique challenges. Spinal cord injuries, strokes, trauma, and neurological disorders are among the leading causes. Spinal cord injuries disrupt the communication between the brain and the rest of the body, while strokes can result in damage to the brain affecting motor function. Trauma, such as accidents, falls, broken necks, anything like that, can directly impact nerve function, leading to paralysis. And neurological disorders like multiple sclerosis or ALS add complexity to the understanding of paralysis. Some symptoms of paralysis, the most common one is going to be numbness or losing motor function, but it's usually caused by an injury or stroke, but you cannot move some or all of your face or parts of your body. Your face could be weak, or your body could be weak or floppy. In even some cases, your face or body is stiff with muscle spasm and twitches, and you could have changes in visions, difficulty breathing. There are a lot of symptoms, and it's not the same for everyone, but these are the main symptoms caused. Some treatments that for paralysis could include physical therapy, pharmaceutical, or experimental treatments. For physical therapy, the main role of that is rehabilitation, focusing on restoring function and mobility over time. Medications or pharmaceutical aim to manage symptoms and mitigate the progression of certain conditions. Experimental treatments uh, or interventions, including stem cell therapies and neuroprosthetics, offer promising avenues for future breakthroughs. There are challenges for each of these. The most common type is physical therapy and trying to restore any, or if at all, any motor function, any feeling, anything like that. Usually, if there's a complete loss of the feeling and numbness, there's unable to do much with physical therapy, but there's always some cases where you can get some feeling back or some function back to that area where there was the loss of function and feeling. Here's my works cited. Um, one Bell's palsy, another was the um, neurons that restored after walking after paralysis. In a case where after paralysis they used a almost placebo effect to restore the conditions after paralysis, and the last one was the treatments and after periodic paralysis. Thank you.